rest. Tonight, new specialist Devon Dolan learned exactly what those Ebola procedures are. And Devon, part of the message is that we shouldn't go into panic mode.
Yeah, Deanie, every hospital here in Utah is prepared and trained to handle a possible patient who could have the Ebola virus. We checked in here with IMC, and they say as soon as a patient walks through the door, that's where their procedure begins, where they ask this list of questions.
In the last 21 days, has a patient traveled to West Africa?
Dr. Brandon Webb has asked this very question more than once within the last month.
Are they exhibiting any symptoms that are consistent with Ebola? Fever, chills, body aches, nausea, vomiting.
And when patients say yes to all of the above,
You just go to work.
Dr. Webb says he's confident
There's no reason for fear.
because Intermountain Medical Center has been preparing their employees for the last 2 months.
We'd be very successful at curbing any outbreak.
The moment a patient becomes a risk,
They're brought into an isolation room.
and then healthcare workers
Would put on one of these. They're impermeable, so they're waterproof. There are booties to put on and leg protection as well. Gloves, of course, a face mask, and a splash guard shield.
These simple garments are enough protection, the only way to contract the virus.
Through direct contact with infected body fluids.
The patient's vitals are checked, electrolytes are balanced, but it will be days before doctors will have a diagnosis.
21 days from the last possible exposure.
Each time, Dr. Webb's patients have come up negative, and he wants them to know.
The risk of contracting Ebola in the United States is very, very low.
And doctors say really the easiest and best way to keep yourself safe is as easy as washing your hands. Reporting live in Murray, I'm Devon Dolan, KSL 5 News.
Thanks for the perspective, Devon.